Betty, why did you go to Washington, D.C.?
I went to Washington, D.C. to represent the Environmental Health Strategy Center as we continue to fight for toxic chemical reform and the current legislation, which is the Chemical Safety Improvement Act, which might help reform toxic chemicals, but it's really badly flawed and we need to make it better. And we met with both of our senators, King and Collins, and our representatives, Pingree and Michoud, and shared our stories and had a wonderful time doing it. And we have still a lot of work to do to convince them to keep working on it until we get some legislation passed that will improve regulation of toxic chemicals.
And can you share your personal story about your work exposure and what that means for you?
I first got involved in toxic chemical reform and learning about toxic chemicals when I was diagnosed with asthma at age 50. And that was from exposure to latex working in the operating room. And it inspired me to look into other chemicals, both at work and at home, and what was out there and why people got sick, and if they got sick from chemicals, and they do. And the research is now showing that there are definite links to a lot of our chronic diseases and things that we never even thought of that might be caused by chemical exposure. And we're looking at the worst of the worst, of the 80,000 plus chemicals in commerce. We know some of the bad players are bisphenol A and phthalates, and Maine has worked hard to get those out of the marketplace and get them out of children's products, baby bottles and sippy cups. And we'd like to get them out of can linings so that the poor, impoverished people who need to buy canned food can buy food that's safe.
Thank you so much, and thank you for going to D.C. with our Maine crew.
Hey ho, toxic chemicals gotta go.